Why is healthcare going up? What is driving that? What's the engine of that?
The one in our outreach to CEOs and even internally, I've heard this. One of them is the GLP drugs are one factor, but it's insurance more broadly. It's beyond just healthcare. We hear a lot about property and casualty from businesses as well, and I think as those costs go up, firms that are tariff impact, they've got to cover those, and I think this is part of the reason you're starting to hear some cost-cutting measures, the trimming of headquarters staff, like from Amazon, is they've got to recover margins for all those costs.
And since we are in kind of an open enrollment period, we had a story in the Charlotte Ledger a couple of weeks ago saying that the increases in healthcare costs, both for the employers and the employees, are going up more this next year than in the last 15 years. And a lot of that is driven by the GLP-1s, coverage of that, employers and HR experts say, as well as maybe people who are scheduling surgeries now that they had put off during COVID.
Because of the price increase coming next year? They're trying to get in before that?
The people have put off surgeries during COVID and now doing some of those elective surgeries. And then the other piece that they speculated was a part of it was, I thought this was really interesting, that AI in healthcare has improved the billing so much that they're able to actually, more accurately bill you and get that money out.
We can't trust them for anything, can we?
And that's a good thing?
Well, if you're a hospital, maybe it's a good thing, but
let the AI pay our bills. How about that?
Yeah.
And I'm not being facetious or not being sensational, but is the cost of healthcare a bubble? And I hate to keep looking at you, Matt, but statistically, I mean, you're.
Well, the demands on the system are growing, right? This is the demographic issue.
Yeah.
At some point, we'll get to the other side of this, and maybe the demand pressures ease up a bit. I'm not a health economics expert by any means, but we've got some sort of near-term issues for the next couple of decades.
Were you nodding, and did you just say yeah because you agree with it, or you see something different?
No, I don't see anything different. I think I see, from my lens, I see things like you were mentioning Prisma in South Carolina. I know that Advocate Help is doing some work in our school systems here, providing so that if a child has an issue, we don't have to send them home, and we have an absentee type thing, we can have that in the schools. And so I think we need to tackle it from all angles.